Hello, and happy April to you, our wonderful Talk Public Health audience. Just like how April marks an important checkpoint in our Earth's cycle around the sun, events in global and public health also appear to be going in a somewhat troubling cycle. This is why our team wanted to share this very special episode of Talk Public Health. Now, we recorded this in early 2019, which seems like a million years ago when Naomi and I were beginning the pilot season of Talk Public Health and were reviewing the topic of vaccine hesitancy. Now, it is a bit eerie that an issue we saw in 2019 is now playing up front and center as the COVID 19 vaccine is being rolled out across nations around the world. So, for those of you listening to this conversation, take this important context with you. One, we were addressing issues in the year 2019. Two, we didn't have the magnificent audio equipment and resources like we have today. And three, we were still public health students musing on how we could put our studies into practice. That being said, we believe the messages that we shared still hold true. So this episode is for you if you want to learn more about vaccine hesitancy. This episode is for you if you want to recognize why the term anti-vax is an issue. This episode is for you if you want to learn more about why we need to close the gap between vaccine hesitancy and to build better trust and care in marginalized and other vulnerable communities. We believe this is an important episode. So if you find the content relevant, please share our podcast link with your friends. Invite them to follow Talk Public Health on social media. And so with that out of the way, sit back, relax, and enjoy the show.
All right, and we are now live. So we're gonna start with this disclaimer. The views and opinions expressed in this podcast are those of the hosts and their guests and do not necessarily reflect the official policy or position, institutions, or endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individual, and we respect the fact that people's views and opinions are subject to change. So take it on, Naomi.
Yeah, thank you, Charles. So thank you for tuning in today to talk public health. As you know, this is our second episode, and we're really excited and ready to talk about this hot topic, anti-vaccine or anti-vax behind the curve. Are we telling the right story?
All right.
And yeah,
Yeah, and I definitely wish to recognize that 20 minutes will not be enough to dive into this issue. We certainly will need to do a part two or a part three to this topic. But Naomi and I just wanted to start out by saying the following: that one, whether you're young or old, vaccinations have made some incredible good things for our world. It's made it healthier for everyone. From the time we're born, vaccines offer us protection to help us stay healthy throughout our entire lives. And vaccines have led to the eradication of debilitating diseases like polio and smallpox, and most recently, measles and rubella, with even more hope on the horizon for addressing illnesses like cancers and HIV and AIDS. Yeah,
yeah.
Naomi?
Definitely, but now there appears to be this threat to this health gains, and with the active vaccination movements that are coming up everywhere, and yeah, so there is a credited decline in vaccination levels in populations all over the world, and of course, we could see now the reemergence of other eradicated illnesses. And today we hope to tackle three questions, and I think the first one will be for Charles. Charles, go ahead.
All right. So the first question really is, what do we mean by anti-vax, and is this term an issue? And so I think what I wanted to say is that just by looking online, this is where I think a lot of people go to find their
Mhm.
information. They go to Google. When I Google anti-vax, I see a lot of stories and hits that take you to links that spell out the story of fear, blame, lawsuits, bans, anti-science, this whole lack of trust of persons in power, and issues around like far right and populism growing. And even right now, we saw vaccine hesitancy being listed as the top as one of the most top 10 most pressing global health threats for 2019. Uh, but from what I see, there's so many negative messages associated with the term anti-vax and people who don't get vaccines. And it really, really was trying to have me to consider, is anti-vax the right term? Are people really anti-vaccine? And maybe this is something that you can tell us a bit more, Naomi, about what you think about this.
Yeah, actually, so this was very interesting, like looking at the negative parts of it, and it's just like this narrative that we try to shut out people that just don't accept vaccination. And it was really interesting to see that the WHO actually prepared this guidance for best practices in terms of people dealing with the so-called anti-vaxxers. And I would say they actually normatively described these people into three categories. That was very interesting. And they started with like the likelihood of them to change their minds towards accepting vaccines. And there was like the hesitant individual who has like a high likelihood to change his mind when talking about like accepting the vaccinations. Then there is the vaccines denier, and that's how those people go like more deeper into this anti-vaxxer state. So for denier, these are people that just the members of that are extreme and really hesitant and have negative attitude towards the vaccination, and they actually do not have an open mind to change, no matter what scientific evidence shows. And then those are the people that we tend to deal with often. And then when we talk about the refusers, those are people that are more like in the middle, but they're really looking forward to understand this. But and if in the scientific approaches show that things are different, they would like to follow where the facts lead. So the thing was, like, we were thinking, so this actually, we're putting them in like different boxes by classifying people into this different categories. And I think maybe this might be impairing our ability to actually get to the root of things with them. So maybe just boxing them and saying that, okay, this person is this person is that, might actually not really clearly make us see the different reasons behind their choice of or their mindset with vaccines. Charles, yeah.
Yeah, I definitely think that that was some good context to be able to provide, Naomi,
Mm-hmm.
and I think that really helps us to like pivot into like the second question, because I feel as though public health professionals, we often beat around the bush, and the thing about it is we're taught about how vaccines, they've been this really good low-hanging fruit for good public health practice for quite some time, but we've sometimes been ignoring, whether that's willfully or not, and not confronting that there are some deeper issues around like medical distrust that have often been considered too difficult to deal with head on. And so I know that's gonna like ruffle some like people's feathers, but I really want to challenge us to think: is there a need for us to be a bit more transparent and aware of some of the issues around medical malpractice, colonialism, racism, and these particular and like how these things connect to disease control and how it may impact people's uptake on vaccines. And so, like, for example, I know that like one of our classmates, who I hope I just said we can have on the show at some point. You all may or may not have like heard about what's going on with the Philippines right now and how there was a vaccine for dengue called Dengvaxia, and the issue right now with the Philippines is that it happens to be a country where the availability of vaccines is already poor so far, and then you saw the introduction of the Dengvaxia vaccine to try and like address dengue because of such a high concentration. And so this gets into this whole issue of about malpractice or like perceived corruption, where at some point there was apparently a skipping of particular checks and balances for the approval of this particular vaccine, and also the way in which the clinical trials were conducted for this vaccine. It happened to also skip some steps or there was some perceived rush in terms of the steps. And you had the Philippines, which had such a really, really high confidence for vaccines, around 90%, dropping to the like low 30s just because of the introduction of a vaccine that people felt as though was rushed. And don't get me wrong, creating a vaccine for dengue, absolutely important. Creating vaccines to be able to address all sorts of like multivalent mosquito-borne issues like Zika, chikungunya, malaria, all of that is quite important. People just felt a bit um, betrayed in terms of the way in which the vaccine was introduced. And I think that that is something that we should take into account. That's something that we need to own up to as public health professionals. What about you, Naomi?
Yeah, that's like totally clear about what you're saying. And for example, like I'll bring up the example of Ghana with the suspension of Ebola vaccine. I don't know if a lot of you have heard about it. So there was this clinical trial for the Ebola vaccine that was supposed to happen in Ghana, but that met a lot of pushback, and the parliament had to suspend it. And this pushback, I could put it towards the spectrum of maybe perceptions of people on why will they want to make a clinical trial in Ghana, for example. Why Ghana? I think that was some of the questions that people were asking. And in terms of like historical notions in terms of colonialism and racism, and it's like, why can't they use it on mice? Or I think there was a parliamentarian that actually said that, why can't this be done on mice and rats? Why does it have to be on human beings? It's Ebola. Like, will people get infected by it? Like, what are the chances of us as a community able to handle this vaccine? So I think like the problem here was that there was this notion already that this was being brought out from like outside people into the country. And also there was a speech by one of the parliamentarians that we have like the best scientists, and if they agree with parliament, why should we like go behind them and accept another opinion from outside? And I feel that that brought the big question on how much of information in terms of vaccination is translated from like the scientists to lay people. Because if these people didn't understand it or even like get the point that this was trying to make, then why would they just accept stuff like that? And I think it was actually then figured out that the Ministry of Health didn't really communicate these facts to the parliament and or to the people, and this actually really affected it. So that's another mistake from the part of us, I would say, as public health scientists, that sometimes we are very sure that what we have works and stuff, but we don't try to understand how we could translate this from our context and our understanding down to like a layperson or down to politicians who also are like representing their people but are not necessarily scientists. And so I would say, like, for example, this means like this will be like in the context of us not owing up to the mistakes in the past or the issues. And another point I would say is also the simple treatment of people in a marginalized group, for example, needs to improve. For example, let's say a person like goes to seek healthcare and is not treated fairly, will not see vaccination as a good option for them. Because if I come to you as a sick woman that is from a marginalized group or from a person of color, and then I tell you this is my issue and you don't treat me fairly, but then you're trying to tell me to take a vaccine that is better for me, then why should I think that this is out of best interest? And I think like as history goes down the line, we could see different examples of how vaccination has been used to experiment with people of color and other marginalized groups. So I think like these issues are things that we really have to look into when addressing this whole issue of anti-vaccination. And Charles, do you have something to add?
Yeah, no, I like completely agree with you, Naomi. I like personally think that if we can improve the way we treat marginalized persons, that would have some really, really positive like downstream effects on like how and whether or not they'll uptake vaccines. Because we always hear stories about like how persons who are homeless, persons who may be migrants, persons who may be a woman, who may be LGBT, how they're actually treated when they go to seek out care. And so it's even like taking a step back from even being anti-vax to how do we actually interact and treat patients, right? And how we treat our patients, how we treat persons who come to us as like public health practitioners. How do we treat persons in terms of just being regular human beings could be really, really important. So yes, I think that this would be a good way to take us into our last question, right?
Yeah,
Yep.
so definitely. And our last question, so how do we begin to address the issue of anti-vaccination? I think like over the few minutes we have talked about how persons have distrust in authority, and actually predominantly in this age of social media, people have become like very vocal and confident in their beliefs, so and statements. So for example, we have like a lot of anti-vaxxers that could take up social media, and in a way they are actually getting people to mistake their confidence for accurate information. So because of the confidence they show and how vocal they are, people tend to mistake this for them giving accurate information and then following these people. And this is rather unfortunate because bad news and like controversial news actually really further spreads than accurate and positive news. So we actually need to begin to combat this. And I know a lot of us like public health professionals are not really pushed to be vocal in terms of things that are right. And there's also this whole idea of negativity bias when people tend to think that things that are bad are better than things that are more accurate than things that are good. So I think like there should be a push for us to combat this. And Charles, what would you say?
Yeah, I think that there are some really, really clear steps that persons can take to try and address this. In addition to what you said, uh, making sure that decision makers reflect the communities that they come from. Can people see persons from their community being in positions of power? And therefore, that helps to create this like level of trust in terms of when persons in authority give these messages about vaccination uptake. And the same thing, decision makers and various stakeholders need to be accurately informed and encouraged to be community champions. They need to be able to know about all of the information that comes around this whole like anti-vaccination movement. Scientists and public health practitioners, we also need to do a lot better around like our knowledge translation. I know that we can get bogged down with boring stats. Well, we don't think that they're boring, but to the layperson, they're boring, hard stats, long papers that I have no interest in like looking at. And it needs to be something that we can present that's simple and accessible. I think that in this information age, it is so important. Persons just don't want to hear from me and you that yes, vaccines work, and like we can make these messages as simple as possible, but it also needs to be accessible online. And that accessibility also means that in teaching in terms of medical school or in public school curriculums, that people are exposed to the history behind certain medical interventions, whether they were positive or negative, because as practitioners we need to understand where some people's mistrust may come from, particularly among marginalized groups who will be the most impact if they can't get vaccines. And we need to improve how we treat marginalized groups of people. And I think that that can make a really, really big impact on how vaccine uptake can happen. So I think that we have just about a few more minutes now, maybe 2 or 3 more minutes. So let's see if we can boil down into some summary point.
Yeah, I think, yeah. So we will try to summarize the whole discussion. And I feel we should have this point. So number one will be like, okay, it's true. There have been controversies surrounding the vaccinations and clinical trials. So I think we should look more into not running away from these issues, but like confronting them and be clear in our communication. So I think it helps a bit when you try to say that of course this happened, but this is the better picture. So I feel that this is really a way to go forward. And also governments must provide the health sector with more support and resources for physicians and public health practitioners to communicate with their patients better. And I think Charles mentioned this earlier on the need for clear communication in terms of like responding, for example, to health crisis. And I think we will talk about communication in one of our series to come.
Yep.
And yeah, So, Charles, what other points do you think we
Yeah,
have?
I like also think that we need to try focus on improving community health. I definitely feel as though this is something that's been lost a bit, and being able to have such a larger focus on community health and being able to collaborate with lay persons, the general public, so that way there isn't this top-down approach to like
Mm-hmm.
vaccine uptake. There'll be kind of a bottom-up approach. And we didn't get to talk about this as much, but I think yes, that we need to also begin to like push back against certain
Yeah.
claims around like branded vaccines versus generic vaccines, and whether they seem like inferior versus superior just because a certain brand comes from it. Because clearly we saw where a big branded company may have introduced a drug, and that still ended up not being as effective
Yeah.
for the population that it needed to be.
Yeah.
And
Yeah.
so,
So,
yeah,
yeah. I would say, like, yeah, we all definitely need to come back to this topic again. And in terms of what feedback do we want from you? So I think we would want to stir up a conversation or discussion. We have the following questions for you guys to think about and discuss. So is there vaccine hesitancy issue in your country? And how do you think public health professionals are addressing this issue? Are they effective, for example, or what other ways could you think we could approach this for it to be effective? And what other ideas do you have surrounding this issue? And finally,
yes.
I would say, yeah, are we losing this battle with anti-vaccines group? Like, are they becoming stronger than we expected, or how do we actually challenge this issue of anti-vaccination? So we look forward to seeing your discussions about this. And yeah, Charles, what else you would add?
Yeah, I definitely just want to say it's been a good time doing this podcast, and I really hope that persons will go ahead and participate, respond to the questions. We'll put them in the link below, and
Mhm.
any other thing that we try to like talk around, we'll make sure that we can try to put links below. And yeah, I guess that this is the end of the show. If you haven't followed us on our social media channels, do that. Press subscribe, hit like on the videos, share with your colleagues. And I just wanted to like end with two things. Treat people well. You have no
Mhm.
idea what people might be going through today. And so like just see if you can like put a smile on your face and share some joy with people. And if you don't have a vaccine, see if you can get one today. Vaccines do work. That's it.
Thank you, and see you next week.
See you next week. All right. Bye bye.